really there's kind of phases in this treatment. Phase one would be from consultation to what we call a pre-surgery visit or records appointment. In that phase one, we're answering questions. We're basically getting information. Phase two is where we go from surgery into healing. So phase one is completely up to you. Some people come into my office and they're very prepared. They're coming from out of state. They know they want me. They've watched every YouTube video out there. And it's like, I don't have to answer questions because literally they found them on YouTube. So phase one can go very quickly. Once we schedule surgery, once you've decided, yes, I want to move forward here, typically we're anywhere from 2 to 6 weeks out. Like right now we're out further than we have been in the past, but it varies different times of the year. But phase two is when we have surgery, and from surgery to, so the time phase between, in phase two is typically between 4 and 8 months. That's a big difference, right? It's hard to know. If you're a fast healer, then 4 months is all the time you need to heal. But I have some patients that literally take the full 8 months to heal up. And it really comes down to taking that medical history, deciding, working with your doctor, seeing if you, the density level of your bone, finding out how you're doing emotionally, because emotionally, this is something that we have to make sure patients can handle also. You know, if they just came out of drug rehab, or they just came off of a really hard thing in their life, last thing we want to do is disrupt their life with something really, really new. And so we want to, you know, we want to check every list, make sure you're healthy, emotionally, physically, and financially. That we don't, you know, financially is a whole other question, right? So phase two is typically anywhere from 4 to 8 months. We hope 4 months. At the end of that 4 months, we bring you in. We call it test day, and that's when we take a CT to evaluate your bone. We look inside your mouth to see if your gums are nice and pink. We look at the device and your bite and see, have we established a consistent bite? If it's check, 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 and everything looks good, then we go into phase three, which is building your finals. And so you say, well, what's the difference between the temporaries and finals? Really, there could be no difference at all. If you love the way your temps look, literally it's taking all that information and adapting it to your new tissue and bone, and then building your finals or Coney device. And so that time frame can be anywhere from, you know, 3 weeks to, you know, 3 months. If you're coming from out of state and you have a really tight schedule, really that's one of the things that's really difficult. But we try to accommodate. Once we know what you want, it's like pushing the button in our office so that it goes through all the phases in our lab. And there's a lot of phases. That's a whole video we could talk about. Like, when we talk about going to zirconia, it's like you're sticking something in the oven for 13 hours and waiting. And then we go to the next phase, another 13 hours. And so it's pretty cool though. So in our office, anytime we go into surgery, we're gonna be able to provide you a smile. I used to do it same day, now I do it next day. And I'm very passionate about that. And the reason why is because I want the patients to have a chance to look at it when they're not numb, when they're not sedated, when I'm not tired also, because at the end of the day of surgery, sometimes it can be exhausting. And so having a day to rest for the patient, come back, not numb, have their family there, look at it for the first time. As you can tell, all of our videos, it's an emotional experience, and we like to make sure we keep that special for the patient.